Hi, hello, how are you? I'm Dr. Marjan, a family physician. Today I would like to address a part of post-COVID long hauler syndrome or long COVID. After this pandemic COVID infection, we have seen there are a lot of people who complaining of neurological symptoms like lightheadedness, headache, insomnia, meaning poor sleep or sleeplessness during night, and thought delaying, or some we call that brain lagging, or sometimes we say brain fog, or even post COVID depression. So today I would like to discuss why it happens and how can we avoid it, and what are the measures we can do, or even what are the things that we can advise to get rid of these symptoms. Because we have seen here the medications or medicines have very limited uh, limited access or limited things to do. So the physical activity or physiotherapy have a major role in this situation to avoid these kind of symptoms. So mainly this kind of brain fogging occurs due to the debris, viral parts floating in this our fluids, mainly in lymphatic system. Around the brain there are CSF and uh, glial or glymphatic system is there. So in those glymphatic fluids, the viral debris, spike proteins are there, and it won't clear it up quickly. So due to this reason, people get post-COVID neurological symptoms. So let's see what are we call glymphatics and how we can improve the glymphatic drainage. Thereby, we can reduce the post-COVID long hauler neurological signs or symptoms. Here is some physiological part of glymphatic system. So what is the glymphatics? This is the brain, and this is called dura mater, brain covering. And if we take from this brain covering, this is the brain part, and this is CSF, cerebrospinal fluid, and this is subarachnoid spaces, and this lymphatic system. So here is the one lymphatic system which is called meningeal lymphatic system. We call them as meningeal lymphatic system. These are meningeal lymphatic system, and it will drain through the meningeal vessels, mainly venous drainage. The another main lymphatic system which drain this lymphatic fluid via cribriform plate to nasal mucosa to cervical lymph nodes. These are cervical lymph nodes. So these are the main two pathway. One is meningeal lymphatic vessels. Via meningeal lymphatic vessels it comes to cervical nodes. The second is olfactory nasal lymphatic route. This route it will comes to cervical lymph nodes. So what is this glymphatic system? Glymphatic system is a glial means non-neuronal cells which are in CNS. Glial cells So the other pathway or the meningeal lymphatic vessels, it comes like this through the cervical nodes. So these are here the cervical nodes. There are lots of cervical nodes. So it is mainly drained to posterior cervical nodes. So there are posterior cervical nodes, periauricular and postauricular and occipital nodes. All from those, these vessels, lymphatic vessels, the meningeal lymphatic vessels drain to these nodes. and thereby to the thoracic duct and to the subclavian vein. So here, so this is the one pathway. The other pathway is this, where the cribriform plate to the nasal mucosa and anterior nodes. So the glial system is a glymphatic system is a glial cell dependent lymphatic system, or CSF, found throughout the brain, component found throughout the brain. The brain cells, neurons are soak in this water or this CSF or this fluid. So it's there in this area called paravascular spaces. These are the paravascular spaces. The green color, these green color paravascular spaces are there. So it will from the arteriolar side, from here arteriolar side to, it goes through neurons, goes through the venular sites. So this space is called Virchow Robin spaces or VRS spaces, and pump into the from this space to pump into the para-arteriolar space to through this transparent chyma to this venular space. These blue color ones are astrocytes and its base. So it will form this lymphatic drainage, the lymphatic vessels. So this fluid from the Virchow Robin space to para-arterial space through the transparent chymal space to paravenular space, and thereby extracellular tissues, and exit through this paravenular space into subarachnoid space, and thereby through subarachnoid space here, thereby through this meningeal lymphatic vessels, it comes to posterior cervical nodes. So while these bathing occur, these debris from these neurons or metabolite product from these neurons are washed out to cervical node, and thereby to left duct, we call that thoracic duct, to subclavian vein, and to go to the venous system and excreted after that. So that these pathways are due to this COVID. These pathways, mainly the cribriform plate, and here it's there. So through this plate, this is the olfactory bulb and this olfactory nerve, which responsible for our smell. So this area gets swelled and inflamed, and after that, that's why we lost anosmia. It's okay, anosmia. We lost our smell sense due to this inflammation. Due to this inflammation, these spaces, these tiny spaces, are narrowed up, and thereby the glymphatic drainage flow has been hindered and blocked, and thereby these debris remains in this brain parenchyma. So that's why we get post-COVID depression or insomnia, things like neurological symptoms. So we have to improve our lymphatic system, thereby we can get rid of these debris from the neurons, and which in turn will improve our symptoms. So we have seen, if you do physiotherapy for this, then it will improve. So this physiotherapy part is very simple. So you have to drain this glymphatic or lymph from this this pathway to from the cervical pathway to thoracic duct to our circulation. So how can we do that? So there are very simple steps are there. So I would like to address those in a second. Before that, when we can do this, we can do early morning and the evening. If you have leisure time, you can use that. Or if you have no time, if you feel that if you are a busy person, even you can use it while you are bathing. When you are bathing, you can use this very simple steps. It will take less than 5 minutes. So so I would like to show some photograph of our lymphatic system. So this is the lymphatic system. So I already told you regarding this lymphatic system for meningeal vessels, meningeal lymph nodes, lymphatics. So it will drain to here and here. So you have lots of lymph node and lymphatic vessel all over our body, and another photo is there. So all over our body here we have axillary nodes here, groin, inguinal nodes. And so when compared to this head and neck area, mainly we have cervical nodes, supraclavicular nodes, and axillary nodes. Those are the nodes we have to empty. So let's see how we can do that. So I will attach some guideline regarding this. How to do this. So this is a UK NHS patient information guideline, how to do self lymphatic massage on your head and neck. So they have very nicely explained. I will attach this with your video. So first they have put, these are the areas that we have to drain the lymphatic from head and neck region or brain. So these are the lymph nodes, the posterior cervical nodes, occipital nodes, and the anterior cervical nodes, periauricular, postauricular nodes, and the facial area and submental, submandibular nodes are there. So these are the nodes. And this is the flow. This is the flow. So you have to always from upward to downward, you have to massage. So this is the flow. And they have shown how to breathe in and out. So when you are breathing in, you have to use your nasal route to breathe in and exhale through your pursed lip. And you start to empty from the base of the neck, from the supraclavicular region to, from this region to downward like this. And after that your axillary nodes you have to drain. So if you drain these nodes, then it will very easy to drain from the head and neck region. And here this is the back of the posterior nodes, how to do it. And this from the occipital nodes to downward, how to do this. And if you have scars, surgical scars, so if you want to massage the surgical scar, then you have to zigzag manner or spiral manner, you have to do massaging. So this is the facial region. And you can do the eyebrow as well, from medial to lateral, or even you can pinch like with these two fingers. So I will demonstrate in this video how to do that. And from this the occipital nodes again, posterior auricular and the occipital node drain to subscapular lymph nodes. So you have to massage from upward to downward to back of your chest like this. So now I will show how can we do this. So you start with the supraclavicular node, from up to down, from these fingers you have to gently massage downward. If you can feel the muscle, then it is too hard. So you have to gently massage like this, base of the neck. And after that you can empty like this the axillary nodes. 5 to 10 times you can do like this. And here also you can do like this. your axillary nodes. Then after that your anterior nodes. So you can do like this 5 to 10 times. Very simple. You can do just a gentle massage like this, and from the posterior aspect of the ear. So you targeting your post auricular nodes and just bring them to like this down, like, and after that you can go to your this the occipital region from here downward like this, downward like this. So you can do that 5 to 10 times. Very simple to use it. Then after that you can use like your finger, you can use the finger like this and do like this to drain from the scalp region, and from here to here, from pre-auricular region like this, and from after that you can use this eyebrow region like this, then again pre-auricular and up to here, or even you can use like your fingers and you can pinch like this from medial to lateral aspect like this, and your cheek region again from here again, and like this from the submental region to submandibular region and anterior node region. So it is a very simple steps. Supraclavicular region from this to this, and after that you can empty this axillary nodes, and posterior auricular region from upward to downward, and after that the scalp region like this backward, and from backside from the occipital node and come front, and after that face you can cover like this, and from the chin region like this. Very simple. Or else you can do some physical physiotherapy like this as well. So this is one set of massaging, how to drain the glymphatic or how to improve the glymphatic drainage. The another set of physiotherapy I am going to demonstrate now. You have to take a deep breath from your nose, and you have to release it from your pursed lip like this. Then you inhale and rotate your neck like this. While you are rotating your neck, you exhale 5 to 10 times. You can do it. Again you inhale through the nose and you turn the other way around, and while you are doing, rotate your neck like this. You exhale through your pursed lip like this. So that also you can do 5 to 10 times. And after that side, you can turn your neck side by side. So you have to use, when you are turning to the right side, you can use your right hand and take a deep breath, and while you are exhaling you turn. You turn as you turn like this and come to a neutral position. Like same thing you can do 5 to 10 times. Again for the left side you can do like this. Take a deep breath before the hand, and while you are exhaling you turn as you can. And come to a neutral position like that. You can do 10 times. You're rotating side by side. After that you have to shrug your shoulders like this, or lift up your shoulders and take a deep breath And while you exhaling, tail like this, turn like this. You have to turn your body like this while you exhaling. Like this, 5 to 10 times you can do, and the other side also same. Take a deep breath. While you exhaling, you turn. This will improve the lymphatic drainage or lymphatic drainage from the head and neck, and thereby to the thoracic region. And you can do a spinal column massage or spinal massage or spinal column massage to improve your the meningeal lymphatic like this. You turn to side by side like this, or from you can stand up and to keep the both hand in the loin region or in the hip, and you can do like this 10 times or 5 to 10 times, and after that the other side also you can do, so it will improve the meningeal lymphatic to come drain into your neck region. So these are the very simple steps, 4 steps, or physical touch and massage steps. Either steps you can do. So when you can do, and who can do these things? Anybody can try. If you have a very severe infections in the face and head and neck region, then you better avoid. Otherwise, anybody can do it. And if you do it, you will feel a very fresh, very refreshing feeling. So anytime you can do. Usually we recommend morning and the evening. If you cannot do in the morning, or at least evening, or at least once a day you can do it. Or if you find very difficult to find some time, some leisure time to do these kind of exercises or relaxation, you can do that while you are bathing in the bathroom or in washroom. So you can use that one, so that it won't take any extra time from your day. So I think it will help you to improve your symptoms, and I think this video will be help to you all. I am Dr. Marjan. Thank you for watching.